Hello, this is a short video on what you should do before and after a total knee replacement, and we're going to go through the exercises. The big thing with the total knee replacement, if you're going to have a total knee, it's a good idea to do all these exercises prior to your surgery, because what happens during surgery, the best you can be is 5 out of 5 strength. That's a muscle grade. 5 out of 5, it goes from 0, 1, 2, 3, 4, everything over 5. Well, 5 out of 5 is the strongest muscle grade you can have. Most people that need a total knee are about probably a 4 or 4 plus, maybe a 4 minus, or even into the 3 or 3 minus because of the pain and the limited range of motion and not using the leg like they should because of the pain in the knee. So the more you do the exercises that we're going to show you just before you have surgery, maybe about a month before surgery, you'll build your muscle tone up and build up the strength to close to 5. You might not get all the way to 5, but if you get like 4 plus, or even 5, then when you have surgery, the surgery in itself will cause you to lose a muscle grade. So say you go into surgery with a 5 out of 5 strong muscle, you're going to automatically go down to at least a 4. Some people go to a 3 minus where they can't even raise their leg up because of the quad right here. This big muscle right here is traumatized from having the tourniquet on them from when they do the surgery and from the pain in the knee and the effusion, the edema in the knee. It'll shut that quadriceps muscle down. So it's a good idea to do all these exercises prior to surgery. And then if you do that, when you get out of surgery, it's the same exact exercise, so you'll be more comfortable and know exactly what to expect with the exercises when you're post-surgery. So we're going to go through the first one. The first one is a quadriceps. Quad set is what it's called, quadriceps set. This is the quadriceps muscle, so she's going to tighten up, tight as she can. See how the kneecap comes up? And the importance is we pull the toes up. You pull your foot up like this in full dorsiflexion. That helps you extend and straighten out the knee. It's real important with a total knee replacement to gain as much extension as soon as you can, because that's going to push the fluid out of your knee. So she holds that for 5 seconds. 5, 4, 3, 2, 1, and relax. And then she'll repeat it again. Tighten up. 5, 4, 3, 2, 1, relax. We do 2 sets of 20, or a set of 20, or 2 sets of 10 every time. You can do this throughout the day. You can do it standing. You can do it seated. Anytime you're sitting or laying down, just tightening up that thigh muscle, especially after surgery, is going to help tone this and get the fluid out of the knee. Because if you picture your knee joint is like this. Well, when it's straight. Well, if you bend your knee, that gap between my knuckles, that's where the fluid will build up. So if you stay with your knee bent for, say, longer than 20 minutes, you go to stand on it, it's like pushing an orange, getting that fluid out. It's like, oh, it's real stiff and it's hard to do. If you keep doing quad sets, that's going to take that fluid out of the knee joint and it's going to keep the knee tight and you're going to get full extension. A lot of people after surgery have an extension lag where if they try and do a straight leg raise, kick up a little bit, they can't hold it. She's going to bend about 2 or 3 degrees like that. See, that's not straight, so you're gapping the knee. So that's putting more strain on the quadriceps. So she tightens up all the way and pulls her toes to her. That makes it for a nice straight leg, and you get the hamstring stretch as well. So that's the first one, is the quad sets. The next one you're going to do is going to put a bolster up under her knees. Now you can use a sports ball like a volleyball, a basketball, even a rolled up towel or a rolled up blanket or a sofa cushion to do this. And she's going to do the same position. She's going to tighten up her knees and kick up both legs together. By doing both legs, neurologically, this leg will help this leg tighten up better. And also, after you had surgery, if this has a little bit of a lag, come down a little bit, she might be like this. Well, then she can visually see how far off she is. And that kind of gives you a check. Oh, I think my knee's straight. Oh, no, it didn't. Look, my good knee's all the way up here. I need to really force it and get a look hard quad set. The harder she goes here and the tighter this gets, then she'll get it straight. So she'll do those and come back down. And everything's a hold for 5 seconds. The longer you hold, the better it is. So she'll kick back up, toes to her, and tighten up. Tight, 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 and you want this almost burning. And a lot of times it'll feel like it's on fire just because of the bruise from the tourniquet from surgery and just from not using it from prior to surgery because it's been so loose and weak because the knee hurt so much. So that's what's called terminal knee extension. So go ahead and bend. Then the next one, this is one of the real important ones, which is hardest for people to do. So what you do is you always bend up the good leg. So like, you're good, like this. And then what she's gonna do is she's gonna do a quad set, toes to her, tight, tight, tight. And then she's gonna raise up. And a lot of people can't do this when they first start, so you need a little help, but you want to do most of it with this leg and this muscle. It's better to do this and hold for 5 seconds and then come back down. If she does real quick and doesn't hold, just like this, up and down, that's not an effective exercise because your quadriceps muscle, put this one down, your quadriceps muscle is formed of 4 muscles. 3 of them don't cross the hip. The 4th one crosses the hip, and that's the strongest one. That hip flexor will do a lot of the work. So if you hold it for 5 seconds, that muscle will start burning and start fatiguing, and then these quadriceps, the other 3, will kick in and do a lot better. The biggest mistake people make is getting in and out of the bed, getting in and out of the car. They're reaching either with their hand or they're hooking their foot under the leg to help it in and out of the bed. It seems mean, but what you need to do is make yourself do the quad set and slowly bring it in with the leg power itself and not help with a hand or somebody else helping it or using the opposite leg. It's very important to make this one do, because if you keep grabbing it with your hand or somebody hooks it, you hook it with your foot or somebody holds it to help you in and out of bed, they're being nice, but they're actually hurting you, because these muscles, as soon as I do this for her to do a straight leg raise, these muscles go, whoo, I don't have to do anything, I'm on vacation, so they're not gonna work. So they're lazy, they don't wanna work, they've been abused in surgery. The more you're tough on them and you make them work, then the faster it'll get your extension. The more extension you have, the less fluid it'll have in your knee, and you get a lot better range of motion. Next one we're going to do is a heel slide. So this is a real simple one. All she does is, what like the thing says, slide your heel all the way back. And it might not go this far. Of course, she had surgery. So if she had surgery, she might come up about, oh, that hurts right there. Okay, well then go back down, and then the next time go a little further, and then come back down, and the next time go a little bit further. So you progressively move it, and you're just stretching the knee and stretching the quadriceps muscle. If you do it quick or you don't go past that pain, it's like climbing a hill. You never get up over the hill. You just go up the slope and then you fall back down. So it's real good to kind of make it slide and come back, and then slide a little further and come back. That's a real good exercise to do if you're having trouble sleeping at night. You wake up because your knee's tired of being straight in bed. You don't want to put a pillow or anything under it because you don't want it to be bent. But sometimes the knee will get sore or painful and wake you up. Well, you can be half asleep and just do 10 to 15 heel slides like that just to get the synovial fluid moving and the joint moving, and then the pain will ease off and you can turn over and go back to bed. That's an easy way to do it, and that way you don't have to get up out of bed and walk. A lot of people get up and walk all night because they can't sleep. So it's real important that you get in your bed and not in a recliner, because you don't want to have it bent like this. Because again, if you're bent like this all night, then that fluid, just like I showed you with the knuckle, that fluid will get between the knee, and then it's hard like a sponge to kind of push back in there. So the next one we're going to do is she's going to sit off the side of the bed, and she's going to do terminal, short arc quads. She's going to kick up, both of them again, tight, 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 toes to her. And she's going to hold like this, and you hold for 5 seconds, and then slowly let it down. So that's an eccentric contraction of the quadriceps muscle, plus it works on flexion. It's a real good way to make the knee flex on its own, and that way gravity pulls it, and the patient doesn't get upset or painful when you grab it and try and bend it. They're actually doing it themselves at their own pace. So she'll do that like 2 or 3 times just to kind of show you how the motion goes. See how nice and tight and good the quadriceps is firing on both sides. Again, neurologically, you fire the right one to help the injured one coming down, and then nice and slow coming down. Yeah. The other exercise we do with a total knee, she's going to come stand right here. So this is for her extension. So she can stand at the counter in the kitchen, and she steps up and does a good quadriceps. She fires this quadriceps and stands just on the operated knee, and then she comes back down and unlocks it. And then she pushes back up. See how extended that gets? It gets it straight. It works on a functional extension, which is called like a closed chain activity for the quadriceps, which gets her better stepping when she's trying to walk get her off the walker a lot faster. And when a total knee needs to walk with a walker, you need to make sure you're doing heel to toe walking. So when they're stepping, it's heel down, good quad set, step. Last thing that leaves the big toe, you come across. You don't want to be bent going, yeah, I'm going, and you're walking with your knee bent. Again, that's not going to get the fluid out of your knee. It's very important to push that fluid out and get as much extension as you can, as fast as you can. And then we work on flexion in the clinic by doing the squats and different things to get flexion going.